Hey there, VCE HHD students. My name's Andy. I'm a VC Health and Human Development teacher. In this short video, we're looking at the old public health, which is part of Unit 3, Area Study 2 for the 2025 plus HHD study design. If you haven't already, there's a range of different ways you can engage with the Health Resources Hub. We've got our YouTube channel, and if you're on YouTube at the moment, you can subscribe with the button in the bottom corner of the video there. That means you'll get alerts to all of our new videos coming out across the year. We've also got our website, thehrh.net.au, where there's opportunities for students and teachers, and that's being updated regularly, so please go check that out. We've got our Instagram, TikTok, and Facebook pages where you can follow us and get alerts to our new videos and other opportunities, as well as SAC and exam advice and tips, and also our email info@thehrh.net.au. Okay, so what is the key knowledge and key skill that the old public health relates to? So this is for Unit 3, Area Study 2. So you can see the key knowledge point is reasons for improvements in Australia's health status since 1900, and it's focusing on three different examples there. We're going to focus just on the old public health today, and that's why that's bolded there. We have done a previous video on improvements in Australia's health status since 1900. So if you haven't already, please go back and check that out as it gives you some good context for the video today. The key skill is analyze data that shows improvements in health over time and draw conclusions about reasons for improvements. So the old public health obviously relates to these reasons for improvements. However, in the previous video, we also talked about some ways in which you can have a look at some data and think about some of these improvements in health over time. So once again, please go back and check that out. Okay, so what is the old public health? So public health in general relates to government-funded actions directed towards improving health and well-being and health status. So look out for that term sort of public because that relates to government. And so old public health is really talking about these government actions from around 1900 to approximately 1950s, early 1960s. And so during this period of time, there was a focus on reducing infectious diseases and injuries as these were relatively prevalent during this period of time. And that was mainly through actions that altered the physical environment and also focused on individual behaviors and what they could do to try to prevent and stop the spread of these infectious diseases and things like injuries. And so you can also see it mentions down the bottom there that these are a few conditions that were the focus of the old public health during this period of time. And so tuberculosis, polio, typhoid, and cholera are all examples of infectious diseases. And so infectious diseases are generally caused by bacteria and viruses. And we mentioned in our previous video that it's good to know a few of these conditions that were relatively prevalent during this period of time, and also to think about how they're sort of transmitted, okay, and what contributes to causing them, because that gives you some good context when thinking about answering questions related to these conditions and this period of time. Okay, so let's look at some actions related to the old public health. So I think this is probably, okay, the most important thing to be across for this part of the course, because you will then be able to link some of these actions into some of these improvements in Australia's health status. So the first one mentioned there are quarantine laws. So quarantine laws is referring to where the government engages in things like screening as individuals are coming into Australia from overseas. And that means that they're able to spend some time looking at whether or not individuals are likely, okay, to be carrying this bacteria or virus and therefore likely to be spreading infectious diseases if they move into the country. And so stricter quarantine laws meant that there was more regulations, okay, regarding what individuals needed to, I guess, tell Australian government about where they'd been, what activities they engaged with, as well as screening. And that means that they're more likely to be able to prevent these infectious diseases from coming into the country. Mass immunization programs, okay, so that's talking about the government being involved in vaccination so that more individuals were immunized, so that meant they're less likely to develop, okay, certain infectious diseases and therefore less likely to spread them amongst the community. Provision of safe water and sanitation, so unsafe water and unsanitary environments meant things like bacteria were more likely to be contracted and then spread as individuals developed conditions, so ensuring people had access to safe water and sanitation reduced the likelihood of this happening. Improved food and nutrition, okay, so that meant things like children as well as adults were likely to have stronger immune systems and therefore less likely to develop infectious diseases and therefore less likely to spread them in the community. Improved housing conditions, so regulations, which meant there were things like improved ventilation, meant there was reduced likelihood of things like respiratory conditions and respiratory diseases being spread and developed by individuals, and that helped to reduce, once again, okay, the mortality from these conditions. Improved working conditions, so improved regulations regarding things like safety in the workplace meant that individuals were less likely to be involved in accidents and injury, reducing things like mortality and morbidity from injury as well. So as I said, knowing some examples related to these kind of actions will help you then to link that to improvements in Australia's health status across this period of time. So let's have a look at a sample question and answer. So the question there is asking you to list improvements to Australia's health status since 1900. Describe how the old public health may have contributed to this improvement for 3 marks. So this question here is asking you to list an improvement in Australia's health status since 1900. But as the key skill indicates from earlier, this could be presented to you as some data, and you might have to interpret that and from that data, okay, single out an improvement in Australia's health status. But I also think it's important, as I mentioned in the previous video, to just know some examples of these improvements. So you can see that in the sample answer, it mentions reduced mortality from infectious diseases. So that was an improvement in Australia's health status since 1900. So then you can see there linking that into the old public health. The sample answer then says improved quarantine laws meant individuals coming to Australia were undergoing screening to help prevent the introduction of infectious diseases to Australia, and that helped to reduce the transmission of these infectious diseases in the community and to help to reduce mortality from infectious diseases across the 20th century. So linking in a mark for that improvement, okay, in Australia's health status that was listed, then a mark for an example of the old public health and making it clear what that actually meant, okay, and what the action was, and then linking that into the improvement in Australia's health status for the 3 marks. Okay, hopefully you found that video useful. There's an ACE revision question book that I've worked on for the 2025 plus HHD study design. And for Unit 3 and 4 students, that has over 500 marks worth of practice questions, which is great for your SAC and exam preparation. It's also got full sample answers for all of those, as well as a full chapter on extended response questions, and also a full trial exam. So if you head to book.acedvce.com, you can order a copy of that in the post, and that will be sent out to you. You can also head to our website, thehrh.net.au, where there's opportunities for HHD students and teachers. And as I said, that's been updated regularly, so please check that out. Thanks so much.